This is part 2, dementia. Okay? Normal aging, no problem. A and B connected. Okay? Normal aging can lead to what we call MCI, another term you need to know. Mild cognitive impairment, very mild, not demented yet, just very mild. MCI. It's called MCI. A bit forgetful, a bit slow, a bit repetitive, but no evidence of dementia. In some cases, MCI developed into dementia. So dementia is a more serious problem. And it's because of the disconnect between A and B. This is another way of showing it. Normal aging, MCI, and dementia. Okay? Worldwide, at the moment, you have around 80 over million people in the world with dementia. By 2050, 152 million. And $1 trillion is spent on looking after people with dementia. Locally, 1 in 10 aged 60 and above may have dementia. So you can divide 100, divide, at least 10 of us here have early dementia. Okay? By 2030, 152,000 Singaporeans are said to have, are likely to have dementia, and 2.8 billion spent in 2015. So it is a real problem because we can't stop the aging process. The only thing we can do is to prevent it from happening. Okay? What causes dementia? Insult to the brain, either structurally or biochemically. So structurally, 4 things can happen to the brain: head injury, infection, tumor, or degeneration. Okay? Now, Bruce Willis, he's 67 years old only, recently developed aphasia. What is aphasia? Aphasia is you can't express yourself clearly. All right? If your Broca's area, the front part of your brain is affected, and you cannot understand conversation, if your Wernicke's area, the back, the red patch on the back is affected. Whatever it is, language is a problem. You can't express and you can't understand. That is the meaning of aphasia. What is causing Bruce Willis aphasia? Is it a stroke? Is it early dementia? They have not mentioned. They just mentioned a symptom, and the symptom is aphasia. Okay? Let's look at this video clip on the aphasia of Bruce Willis.
Debbie, good morning to you.
Good morning.
We know you haven't treated Bruce Willis, so but just generally, because a lot of folks are saying aphasia, not sure they've heard that. What is aphasia?
Aphasia is when you have trouble communicating with another person. You know, whether you're doing it through sign language, through writing, or through speaking, you're not able to communicate your thoughts or in some cases, be able to understand what someone else is telling you.
Is it really obvious? Because we all kind of can't remember things. Is it something that you listen to somebody and say, wow, there's something really wrong here?
Sometimes it's subtle. Sometimes you think, oh, is this person deaf? Can't they not hear you? And sometimes it's much more apparent, where you're clear that the person's really having trouble speaking, or they really aren't understanding what you're telling them.
Now, there's a few different ways that this can come on. You could have a stroke, you could have a head trauma, it could be dementia. But can it kind of come on slowly and then progress and get worse over time?
Yes, in some cases, depending on the cause, it can start slowly and progress, and sometimes it can happen abruptly. Sometimes you're talking to someone on the phone and suddenly you can't speak because you've had a stroke. And that's a case where you have to go to the emergency room right away.
Look, we've all been there where we can't remember a word. It happens to us on air, unfortunately, here and there. I can think of one yesterday, actually.
Right.
But is that something to worry about? Oh my gosh,
Right.
could this be coming on? When do I need to see a doctor like you?
Right. So trouble finding words and trouble finding names is common for all of us. And it's a common symptom. But it's when the problem persists, if it's interfering with our functioning, that's when you really need to seek help.
Again, we know you haven't treated Bruce Willis, but can there be improvement? Are there things you can do if you have this that you can get yourself back on track?
Yes, you can do speech therapy, language therapy, those kinds of things can help depending on the cause. So sometimes if you have a stroke, you can make a complete recovery from a condition like aphasia.
All right.
The key word is depending on the cause. Treatment is depending on the cause, whether it's reversible or irreversible. I want to introduce the word apraxia. Apraxia is different from aphasia. Apraxia is inability to carry out a function. Dressing apraxia is this lady who has dementia cannot put on the coat properly, cannot put on the dress properly. And this is called apraxia. Basically, apraxia there are 4 lobes. There are 4 lobes in the brain. All right? Apraxia affect the parietal and the frontal lobe. Aphasia affect the temporal and the frontal lobe. So, depending on which part of your brain is affected, you show different kind of symptoms. Now, reversible and irreversible. Dementia is an umbrella term. On the left is reversible dementia, from delirium, brain injury, brain tumor, metabolic disorders, nutritional deficiency. They are correctable. If you have vitamin B deficiency, you take vitamin B, you can correct your dementia. On the right is harder. Alzheimer's, vascular dementia, frontal temporal dementia, there you are, depending on which lobe is affected. Lewy body's dementia, and Parkinson's disease can lead to dementia as well. There you are, brain injury, head injury, infection of the brain can temporarily cause you to have dementia. Infection, brain abscess. Abscess, once you remove the abscess, your dementia will go away. Tumor, if you have cancer in your brain, once you remove the tumor, your dementia will also disappear. This is a very interesting case. Came out on 20th of May, just 8 days ago. This man developed a cancer called glioblastoma. The glioblastoma sits on the amygdala, which is part of the limbic system. And it grew larger and larger. And what were his symptoms? He was very hot-tempered. He was very grouchy. He would yell and shout at his wife. Normally, before the cancer, he was a very quiet man. Suddenly flare up easily, suddenly very aggressive. His wife could not take him. His wife divorced him, thinking that he had a personality change. But actually, he was having a tumor. He went to see NUH neurosurgeon, neurologist and neurosurgeon. They took MRI scan and found a big glioblastoma at the amygdala area. They took it out, he immediately improved. His wife was so happy, his wife came back to him, attended to him, and I think willing to come back to him. So this is an example of a reversible dementia. Now, Alzheimer's is not. Alzheimer's is a degeneration, death of brain cells. If your brain cells die, very difficult to get back the brain cells, and therefore it's irreversible. And what happened is, because of the death of brain cells, the ventricles enlarge. You see, the ventricles is larger on one side than the other side. See, the ventricles enlarge, and then the brain shrink, the shrinkage of the brain, because of death of brain cells. And in Alzheimer's disease, you also have beta amyloid plaques suddenly form in the brain, and it prevents communication between the neurons. And you also have tau, T-A-U. Tau are, again, tangles, neurofibrillary tangles found in the brain, and it prevents smooth communication between the neurons. Okay, this is a this is a local example of Alzheimer's disease. Thomas Ong.
When people meet me on the street, they probably won't know I have dementia. They will treat me like any ordinary person on the street. I wouldn't expect them to treat me differently, okay?
So my father here is now 83, and he used to be a school principal of several schools, and he's, to me, a lifelong educator. Hey Papa, later got tuition with Esther. She'll come over after lunch, okay? Okay.
Well, it's in my blood. Yes, I love kids and I love to teach. I do need Michelle's help sometimes.
Sometimes only, meh?
Without her around, I feel completely lost.
Oh dear, never mind. I'm always here for you.
Thank you, thank you.
So I think it all started with my dad forgetting a lot, and then we suggested that maybe he got it checked out, and then that's where he went to the polyclinic. We learned that, the progress of the condition can be delayed. So we were introduced to this program called Voices for Hope. We thought, Voices for Hope would be a great program for me to understand how to support him, and also for him, to find strategies of managing the condition. My father here is very unique and special, and to be honest, in the earlier days when he was working, he was very busy working, so I never really got to see his talent. So what is the activity that you really like to do?
Yeah, it's called silent disco. It's good because music that I love to listen to, the sentimental, soft, waltzing type. People who don't know that I have dementia, how do I go and tell them I got dementia, right? It's a chicken and egg situation. It's just that I'm forgetful, and I hope they are understanding and give me the space and time to be accepted. Treat me like ordinary people. That's the most important thing.
Right. Lewy body dementia, again, you look at the brain, they have Lewy body. And one example is Robin Williams. He actually had Lewy body dementia. And he was depressed, and he took his own life, which was very sad. Parkinson's disease and dementia. Parkinson is due to low level of dopamine. After a long period of time, they can also have dementia. But it's principally a motor problem. They are very rigid, they have shuffling gait, they have tremors. So it's a movement disorder. But actually, in later stage, they can be demented. So the 7 stages of dementia, first, no sign. After that, very mild cognitive decline. Cognitive is your B, your prefrontal cortex. Your thinking is decline. And then mild decline. And then you have early stage dementia. You have moderately severe dementia, and the late stage dementia. Ladies and gentlemen, the challenge is to pick the first 3 stages. Make sure it doesn't go to the early stage dementia. The challenge is to, now you know, sleep well, eat well, breathe well. Okay, the 3 functions. That is the first 3 stages. Okay, and in another way of putting it is 3 stages: mild, moderate, and severe. Okay, now late stage dementia is very sad. I will show you. I will skip this video. I will go on to screening test. Then after tea break, we talk about tips for caregivers. If you can draw a clock, you are healthy. When you cannot draw a clock properly, you have problem. So after tonight, go and test your friends. Take a piece of paper and ask them draw a clock. You can draw a clock. First of all, they'll laugh at you. Hey, why you ask me draw a clock? Anything wrong with you or not? And then you know this person is likely to be normal. If they cannot draw a clock, why? Drawing a clock requires your 5 executive functions. You have to plan. First of all, you draw the round thing. You got to put the 12, the 6, the 3, and the 9. Plan where to put. You got to prioritize. Then after that, you add 1 and 2, 4 and 5, 7 and 8, 10 and 11. Prioritize. That is your 3 function: plan, organize, and prioritize. If you have dementia, you don't have B. Your B and A disconnected. Your 中脑大脑 disconnected. You stare at a piece of paper. You put a 12 there. Look at that. That 1, 2, 3, 4 all jumbled up. Yes? And not only that, they say digital clock. I don't use this kind of clock anymore. Very good point. So we normally show them a clock first and then let them draw. Okay. Thank you very much. You have just started the Q&A. Okay. So this is how we find out. And there is AMT, Abbreviated Mental Test. Only 10 questions. If you can't answer some of these questions, there is a possibility of dementia. One of the questions is to count 20 backwards. Maybe Kofai can help us. How you count 20 backwards? Face the class. 20 backwards to 1, yeah. Seriously. Very super fast. But if you have dementia, you struggle. 20, 19, then you struggle. So you have 2 tests already. Clock drawing test, 20 to 1. Okay. This is more advanced. 30 questions, mini mental state examination. You need to score 24 and above in order not to have dementia. If you score 20, 10 out of 30, likely to have dementia. Now, I have my own simple way of telling mild, moderate, severe dementia. I will show the patient a watch. Right? If you have no dementia, immediately you say, watch lah, Dr. Ang, why you ask me simple question like this? But if you have mild dementia, take a while. Watch. If you have moderate dementia, this one for telling time, right? Right, telling time. But what is it? Telling time lah. What is it? Telling time lah. That's moderate dementia. Cannot say watch, but can tell you what is it for. Advanced dementia, you show them the watch. They stare at you, they stare at the watch. They stare at you, stare at the watch. They can't even say for telling time. You go back and test your friend. Now you understand? I like to simplify. Very easy now. The same for pen. No dementia, they straight away laugh at you. Why you give me this kind of simple question? Pen lah. The mild one, take a while. Pen. But still got the answer, pen. The moderate one, for writing one leh. Writing. What is it? Writing lah. Why are you angry with me? Okay. Then severe dementia, can't even tell you it's for writing. Can't even name it. They stare at you, you stare at them. So this is severe dementia. You are living in a glass cage. One day, a doctor in her early 70s walked into my clinic. Dr. Ang, I want to do an LPA. I know her husband. I say, where's your husband now? Her husband is a famous surgeon. My husband is in a nursing home. Severe dementia. I go and see him. He see me. I see him. He doesn't recognize me. Dr. Ang, I spend 4,000-5,000 a month. It's a high-class deluxe nursing home. I visit him only once a year. Wow, wow, so heartless, right? He said, Dr. Ang, no point. Every time I go and see him, it's like attending a funeral. Can't recognize you. You can't recognize. He can't recognize you. You can recognize him, but he cannot recognize you. He doesn't know who you are. And basic care is there, nursing care is there, tip-top nursing care. Well looked after, but just cannot connect. And it pains me, Dr. Ang, it hurts me. That's why the song, it hurts when I see the struggle on your face, the demons in your head. Struggle. So this is an example of severe dementia, living in a glass cage. They see you, you see them, but you can't connect with them. It's the saddest part about dementia. Once you have it, it's severe, it's irreversible. Okay, there are guidelines, MOH published guidelines on how to help people with dementia. All doctors follow the guidelines. We'll stop here, just nice.